I want to start off today by talking about what Canadians are going through right now. They were really hopeful. A lot of people were very hopeful with the announcement of a vaccine. And now with the delays and the problems with the rollout, they are really worried about what this means. So we need to, more than ever, focus in on getting the vaccines to everybody. We need a clear plan. People need to know what's going on. There's a lot of uncertainty and fear, and the only way we can dispel that is to give people real concrete evidence and a clear plan about what's going to happen next. So we're going to continue to fight for a clear plan on vaccines to help people out. We know that seniors remain extremely vulnerable, so we want to see real supports in place for seniors so we can prevent the needless and just painful deaths that we're seeing in long-term care homes. And as always, we want to put in place every measure possible to stop the spread of COVID-19. While we support the idea of limiting non-essential travel, we know the most important thing we can do right now is to increase access to paid sick leave. So we're going to continue to fight for improving paid sick leave. These are some of the top priorities that we're going to focus on this week. Donc, je sais que les annonces des vaccins étaient des bonnes nouvelles pour les Canadiens et Canadiennes. Mais avec les délais, avec le manque de clarité, le manque de détails, avec la livraison des vaccins, les gens sont inquiets à ce moment. Et je comprends ça. Ça, c'est pourquoi on va continuer d'exiger le gouvernement libéral de présenter un plan clair avec tous les détails, de montrer la transparence pour donner de confiance aux gens. Ça, c'est essentiel. Aussi, on va continuer de lutter pour les protections pour nos aînés dans les centres de soins de longue durée. Ça continue d'être un grand problème et ça continue d'être une priorité pour nous. Et finalement, on est d'accord avec les limitations sur les voyages non essentiels, mais on veut encore souligner l'importance d'avoir mieux accès aux congés de maladie payés. C'est un des outils les plus importants à ce moment pour arrêter la propagation de la COVID-19 dans les milieux de travail, où c'est une des plus grandes menaces pour la propagation de la COVID-19. Donc, on va continuer de faire ça. Ce sont nos priorités et je suis prêt maintenant pour vos questions. I'm ready for your questions now. Thank you so much.
Et nous allons maintenant passer aux questions, commençant par les questions au téléphone. Un petit rappel, comme toujours, une question de suivi. We'll now take questions, starting with questions on the phone. Quick reminder, one question, one follow-up. Operator, do we have a first question?
There are no questions registered at this time. Il n'y a pas de questions enregistrées pour le moment.
Okay, back in the room. Lee?
Lee Berthium, Canadian Press. Good to see you.
Hey there.
I wanted to ask you, over the last few days, we've seen a lot of phone calls from the government to European counterparts. We saw the Prime Minister talk to the European Commission President. We've seen the Trade Minister talk to her counterpart. We've seen a variety. What does this say to you? Do you take this as a sign that they're worried? Are they working really hard to head this off? Are you reassured by this?
Well, we need to, I think a couple of things come to mind. One is that we need to know that the government is putting all their effort to securing the vaccine. And that goes for the concerns that we're seeing coming out of potentially some limits in European supply making it to Canada. It also means that this Liberal government and Justin Trudeau shouldn't be focused on an election. They should be working on entirely how to get enough vaccine and how to vaccinate all of Canada, everyone in Canada. That's got to be a priority. And I think what it also highlights is how important it is to have a clear and transparent plan. We don't know exactly what's going on. These questions that you raise, legitimate questions, are being asked because the government hasn't put out clearly what are the negotiations, what are the contracts. And we know that other countries have done that. United States has put out their clear, their contracts with other companies. We've seen other countries like Australia put out a detailed plan around how they're going to procure and which vaccines, if they are approved, would be procured, and how those detailed plans were something Canada never had. And as a result, we're seeing the outcome of that is a very poor procurement and delivery of the vaccine.
Ministering this morning and other officials indicated that Canada is putting together possible plans to kind of, I guess, leverage or somehow head off or address any efforts by the European Union to cut off exports of vaccines to Canada. Would you support such measures? Is this an appropriate approach?
Well, we need to do whatever we can within our means to make sure we get the supply that we need. It also highlights how important it is to be able to produce vaccines in our own country. We made this announcement months ago, and I think it definitely merits repeating. The Liberals or the Conservatives cut our capacity. They shut down the publicly owned facility that we once had that produced vaccines, that was one of the innovators in the world for developing vaccines and things like insulin, as well as producing non-critical drugs. The Liberals had decades to be able to reinstate it, did not. And we are in a pandemic now as one of the world's largest economies, and we do not have the capacity to make vital vaccines or critical drugs in our own country. That is a problem. And what we knew for this for a year, that vaccines would be the path out of the pandemic. So it's inexcusable that there wasn't any plan in place to be able to produce it here at home. And these shortages and concerns about not getting it from Europe, concerns about factories being retooled, concerns about now Moderna saying that they're not able to produce or deliver as much. All of this points to the fact that we are vulnerable because we cannot produce this here at home. We've made this a clear priority for us. New Democrats believe we need to reinstate publicly owned production of vaccines and critical drugs in Canada. We need to have the capacity. This is not going to be the last pandemic, and we need to be ready for now and for the future.
And I'll check once again if there's one question on the phone. Opérateur, avons-nous une question au téléphone?
Négatif, nous n'avons pas de questions au téléphone.
Back to you, Lee.
Sure. So, one other thing I wanted to ask you about was long-term care centers. This is something you were in front of the one in Toronto a couple of weeks ago, raising concerns about private, for-profit companies running them. This is obviously it's a provincial responsibility. Just wondering, I know you've spoken to this a bit in the past, but what more you want to see the federal government do in terms of long-term care facilities, especially as we're seeing ongoing outbreaks?
Certainly. First, let's be really, really clear. There is overwhelming evidence that points out for-profit long-term care homes are more dangerous and more deadly to their residents. This is incontrovertible evidence. It is undeniable. Wherever we see for-profit, we see more infections, more deaths. And it is very directly because in the for-profit model, the goal is to make a profit, which means they cut some of the essential care, which means less staffing, less quality food. And we have seen the results of this. It means our seniors are worse off. So we are saying the federal government needs to come out clearly and state this as a value statement. For-profit should have no place in our long-term care homes. Secondly, the federal government can start right now with the second largest long-term care home provider in the country, Rivera. It is completely owned by a federal agency. It absolutely could be made public. The federal government could do that right now and then work with provinces to make sure the delivery of care is there. But that is something completely within the federal government's power. We had press conferences with the president of the public sector unit, whose members in their pension own this federal agency that owns this home, and they're saying very clearly, we don't want this to be part of our portfolio. We don't want this. The government should make it public, should buy it and make it public. So that's a starting point. And then national guidelines around what are the best practices, what are the best ways to keep people healthy and safe, what are the standards we should apply, the hours of care, the conditions of workers, the things that we've learned from this pandemic. We should establish those. And then finally, we should connect the same Canada Health principles for funding of our healthcare system should also apply for our long-term care homes. No one wants to see public dollars go to a for-profit home that ends up using it to pay out dividends to the shareholders. That is outrageous.
Different subject. Over the weekend, it was reported that the NDP has paid off its election debt. Wondering if you could, well, first of all, confirm that, and what that means for the party, especially as we're looking at the possibility of an election this year.
Confirmed. Yes, we are in an excellent position. A lot of respect to all the people involved, our current national director, our previous national director, all of our strategists, all of our campaign chairs, everybody who made this possible, our team, and people that saw in New Democrats a voice for them, fighting for them, who stood up for them and are going to continue to do so. Thank you to them. We are in a great position now. We've paid off not just our 2019 campaign debt, but also the remaining 2015 debt that was left behind. We are paid off our debts, money in the bank, and are ready to fight an election. I do want to be clear, though. This means that we are ready to fight an election, but we are not willing or we are not wanting to fight an election. We are willing if we need to, but we don't want to. What we think right now, the priority should be at this critical stage, all the emphasis should be on finding and procuring the vaccine and delivering that vaccine to all Canadians. That should be our priority right now, not going to an election. So I'll say again to Justin Trudeau, this is not the time to go to an election. We are ready, but we do not want an election right now. We want to focus on getting help to people.
And once again, I'll check on the phone if we have any question. Opérateur, avons-nous une question?
Oui, la prochaine question est de Catherine Lévesque. The next question is from Catherine Lévesque de la Presse canadienne. Please go ahead. Your line is open.
Oui, bonjour, M. Singh.
Bonjour.
Bonjour. Je ne sais pas si vous l'avez déjà mentionné, là, je m'excuse, je suis un peu en retard, mais je voulais parler de votre rencontre avec M. Legault tout à l'heure. Je me demandais juste s'il y avait un autre sujet que vous vouliez aborder, mis à part là, les transferts en santé.
Oui, merci pour la question. Aujourd'hui, la rencontre avec le Premier ministre Legault, c'est une rencontre que le Premier ministre a demandé. Elle a demandé pour la rencontre. Comme président des conseils qui représentent les autres premiers ministres du pays. Donc, la priorité, c'est les transferts en santé. Et c'est essentiel pour nous, comme un parti dans nos cœurs établi pour promouvoir la santé et pour partager cette valeur d'avoir accès aux services de santé. Tout le monde a le droit de le faire. Donc, pour nous, c'est quelque chose qui nous touche au cœur. C'est important. Aussi, en général, les soins de santé, ça va toucher aussi les centres des soins de longue durée. Ce sont les priorités maintenant pendant la pandémie et c'est ce qu'on va parler de ces enjeux.
Mm-hmm. Mais qu'est-ce que vous allez lui dire exactement au sujet des centres de soins de longue durée, étant donné qu'on le sait que M. Legault s'oppose fermement à l'idée des normes nationales en santé? Donc, est-ce que vous allez tenter de le convaincre de la nécessité de normes? Qu'est-ce que vous allez lui dire exactement?
Donc, premièrement, je suis d'accord avec le Premier ministre quand on parle de transfert en santé. Je pense qu'on doit les augmenter. Il y avait des coupures pour des décennies, donc on va être d'accord sur ce sujet. Et je crois qu'on va avoir une bonne conversation sur l'importance d'augmenter les transferts. Avec les normes, c'est clair que pendant cette pandémie, on a appris beaucoup. Et ça peut nous aider dans toutes les provinces de présenter c'était quoi ces connaissances, qu'est-ce qu'on a appris qui a fonctionné pendant la pandémie pour soigner nos aînés et qu'est-ce qui n'a pas fonctionné. Et si on peut assembler aussi, on peut avoir toute cette information dans le même endroit et on peut la partager comme ce sont les guides. C'est un guide pour comment on peut mieux soigner nos aînés. Je pense que ça, c'est quelque chose de positif. Et les normes, effectivement, c'est une façon de rassembler toutes les connaissances qu'on a apprises pendant ces pandémies pour protéger nos aînés. Et c'est quelque chose que je crois que c'est essentiel de faire.
Opérateur, avons-nous une prochaine question?
Nous n'avons plus de questions pour le moment. There's no more questions at this time.
Ceci met fin au point de presse de M. Singh. Thank you.
Thank you very much. Merci.